Hello, welcome everyone to this webinar on measuring gender equality at the time of the COVID-19 pandemic. As we have more participants joining in, I will get ourselves started. My name is Arnab and I work at the Center on Gender Equity and Health. I'm joined by my colleagues Meredith Pierce and Nicole Johns, and together we will be facilitating this session today. We are also excited to have Dr. Mohan joining us from Maharashtra, India. Dr. Mohan also works with GEH, and today he will be sharing insights from very interesting project that he works at the intersection of family planning, gender equity, and IPB.
Hello, everyone. This is Meredith speaking. So today we are going to take questions at the end, and we just ask that you will type your questions into the chat box throughout the webinar, and then we will wait till the end to answer them. And you can also, we also ask that you'll keep yourself on mute. We are using regular Zoom, but we do want to just keep things going until we get to hear from you all at the end. We also want to welcome you to type into the chat box and let us know where you're joining us from, introduce yourselves, so we can kind of see who's on the call. So we'll get started now with our presentation. Thanks everyone for joining us. So just a little bit about the Emerge project. We are a project based out of the University of California, San Diego, at the Center on Gender Equity and Health. And we're a project funded by the Bill and Melinda Gates Foundation. We are focused on compiling, evaluating, and improving global gender equality and empowerment survey measures. So we're a one-stop shop platform where you can find evidence-based survey measures, learn about the science of survey measures, and share your validated survey measures as well. So we have a team of scorers who actually do literature reviews and also receive submitted survey measures that they then score and put in this database. So we have over 400 measures across these dimensions, such as economic, political, health. And what they all have in common is that they're all gender equality and empowerment measures. So we welcome you whenever you have a chance after the webinar to explore the measures. The website is emerge.ucsd.edu. So we'll just show you quickly what this looks like. So if I'm to click on the psychological dimension and to look at the categories that come up there, we have things like agency, collective agency, optimism. And then when you click in to agency and you want to select a measure, you can pull that up, and here's what a measure page looks like. So all of our 400 measures on our database have their own landing page. And this includes the items themselves for the measure that you can cut and paste into your work. So this is really for survey researchers, evaluators, monitors, practitioners. And we show the score. As I mentioned, we have a team of scorers. So we show the strength of the measure using psychometric scoring, and then the citation frequency and the original citation at the bottom of the page. So as we mentioned, we also accept submitted measures from researchers that we score and add, and then obviously they're all credited to the original publication. So that's us, the Emerge project. And we'll go back to our slides. The other thing I wanted to point out is that we have a lot of resources available on good measurement science. So as I mentioned, we have psychometric, excuse me, we have psychometric scoring that we do. And so we actually talk about good measurement science, our scoring methodology, and what that involves. So those are available on our site under the resources tab. All right, so today we're going to talk about, first of all, why it's important to measure gender equality and empowerment in the time of COVID. And we're also going to touch on the gender issues that are arising or increasing at this time. Secondly, we're going to talk about, how do you find and select best evidence measures on gender and COVID. We're going to talk about, under that topic, what key areas of gender equality and empowerment should be surveyed at this time. And then lastly, we're going to talk about some of those real on-the-ground issues of how do I conduct surveys on gender equality and empowerment ethically and safely during this pandemic. So we're going to talk about viral safety for in-person surveys, confidentiality for phone surveys, and then sensitivities or concerns that are arising for collecting data in the field during this time. All right, so first we want to talk briefly about some of the foundational concepts, and then we'll move quickly into the other content. So why is it important to measure gender equality and empowerment? First, when we're talking about these terms, gender equality, what are we talking about? Gender equality is a state in which rights and opportunities for people are unaffected by gender. Gender equity is a form of social equity measured as what is just and what is numerically equal by gender. And then gender empowerment, when we talk about that, is the process and the outcome where an individual or a group becomes critically conscious of gender-based constraints, and they engage in acts of agency against these constraints towards self-determination. These things, gender equality, equity, empowerment, they're all affected by the social and cultural context, including social norms, as well as the internal attributes of individuals and groups, such as self-esteem, intrinsic motivation, of individuals and groups seeking equality and empowerment. All right, so why measure GEE in the time of COVID? Just briefly, these aren't very different from why we need to measure gender equality and empowerment generally, but in the time of COVID, it becomes even more pertinent. We want to understand the role GE factors have on COVID and shutdown outcomes. Outcomes like health, well-being, economic empowerment, development, and we also want to evaluate the impact of gender transformative programs factors related to GE in the time of COVID. And lastly, we want to monitor effects of the COVID pandemic and the resultant shutdowns on the progress at scale on Sustainable Development Goal number 5, which deals with gender empowerment. So now I'm going to turn over to Arnab to walk us through the next section.
Thanks, Meredith. So with that brief intro about the foundational concepts of gender equality and empowerment, we move on to the next key question of how do we select and find measures on gender during the COVID-19 pandemic. And we will be pointing to Emerge as a platform, and we would also be using some of the other resources that can be used to identify and select measures. But before we begin, a couple of key concepts. It's really important for us to make a distinguish between the different terminologies that are used when we talk about measures. And two of these critical terminologies are survey items versus scales. And just so that everyone is on the same page on these two concepts, survey items are individual questions or components of a measure. So they can be thought of as the basic building blocks of a particular measure. If we want to, say, measure family planning or reproductive autonomy, uh, every single question that builds up to that measure will be called a survey item. It relates to one specific construct, whereas a scale is a combination of items that can be combined together to form a composite score. It relates to one specific construct again, but may capture several sub-constructs such as depression, hopelessness, sadness, etc. Uh, while trying to find and select good quality measures, we always come across this term called psychometric properties. And it's really important that when we are trying to adapt new measures during the pandemic, or when we are trying to adapt new measures to apply for gender equality and empowerment constructs, we keep in mind that we select measures that are really sound and really robust in terms of their psychometric properties. And we won't get into a lot of details on these. However, a few key concepts are related to reliability and validity. Just to make a very broad generalization, reliability generally tests how consistent a measure is. Uh, a good example of that is internal reliability, which talks about how well are different items related to each other within a measure. How well do the items hang together well, or how are the items linked together? Uh, a good example of that could be the 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 decision making scale. So, for example, if we want to create a decision making scale at the household level, and we have a set of 5 questions that relate to decision making, if we add a sixth question that is not related to decision making and deals with, say, freedom of movement or mobility, that actually would tend to bring the overall reliability, or at least the internal reliability of that particular measure, down quite a notch. While selecting measures, one key idea that we should always be looking for is that whether the measure has been tested for internal reliability or not, and how well do these items hang together well. A related concept to internal reliability is external reliability, which has to do with repeat consistency. How consistent does a measure perform when the same measure is applied to different populations over time? Or how consistently does a measure perform when the same measure is administered by different 2 or 3 different raters? Ideally, if a measure is like really strong, even upon administering it repeatedly over time, it should give us similar results, right? Even if a measure is really strong, even if different raters are administering the same measure, they should be getting similar results. So that's the broad concept of internal and external reliability, which brings us to the idea of validity, which tests if the measure captures what it was intended to capture. If I wanted to capture reproductive autonomy, uh, did I end up asking questions that specifically dealt with reproductive autonomy? The first uh, set of validity deals with content validity or face validity, which is which is just doing what we talked about. It specifically uh, measures whether a set of items that are used in a measure uh, are have face validity. Do they measure what they say they are measuring? And then we have 2 other forms of validity. The second one here talks about criterion validity, which is nothing but a measure of uh, how well uh, the measure that we are using, or the measure that we are trying to adapt, uh, how well does that correlate with a measure that's a gold standard in the field? So if I'm creating a new measure to be specific to my context, and there's already a gold standard measure that the entire field adheres to and uses, and it has already been proven to be having high reliability and validity, how well does my measure perform against that gold standard. And there are different mechanisms to assess criteria on validity, but that's the general idea. The next form of validity is construct validity, which essentially means that if I'm trying to measure uh, a construct and I've come up with a set of items to do that, my set of items or my measure should ideally be correlated with similar constructs. So if I'm trying to create a measure for agency, uh, my measure should ideally correlate positively with uh, other constructs such as self-efficacy or decision making. So that's again a very broad idea of construct validity. But these are some of the concepts that we should keep in mind when we are trying to find measures and trying to adapt them to our settings. Uh, while adapting these measures, we need to look for whether the measures that we are adapting from, whether they were tested for reliability and validity. If yes, did they have a high score on internal reliability? Did they have a high score on constructability and content validity and so on? And as Meredith talked about a couple of minutes ago, Emerge is a really good resource to do that because of all the 400 uh, odd measures that we have curated. All of those measures have been tested and have been documented for their psychometric strengths. So we go into each of these measures and we try to find out how strong they are in terms of reliability and validity, which gives users a sense of uh, whether whether or not they can be used as it is, or whether or not they need further psychometric testing. Uh, with that core idea on psychometrics, we move on to a specific topic of the key areas of gender equality and empowerment that should be surveyed at this time. And increasingly, we are seeing that ideas of gender equality and empowerment are coming up during this pandemic right from the beginning. We have been seeing that more number of cases and deaths have been recorded among men. Uh, we have also been hearing about a lot of elevated partner violence that has been going on since the beginning of the pandemic and the shutdowns. We also know that there's a disproportionate burden of domestic work on women, and that women form the majority of healthcare workforce, especially on the front lines. Uh, in addition, women are also the primary caregivers at home, which also increases to the burden uh, that, that started during the pandemic. So all of these are really important motivators for us to focus on some of the key areas of gender equality and empowerment. In addition, we have a couple of other aspects that really affect adolescent girls too. There's evidence that's coming out which says that girls may be more vulnerable to school dropout. They share a greater household burden, and that may offer less time for studies, and that there could be a possibility of increase in child and forced marriage and sexual exploitation due to the shutdowns and the lockdowns being implemented in different contexts. And finally, at, this pandemic can also lead to lesser freedom for girls in households that have greater presence of males. There's a really interesting study that was led by Population Council Kenya, which studied informal settlements in Nairobi, where they found that women were impacted more on many social health economic dimensions uh, as compared to men. Women were more likely to skip meals during the pandemic, to forego healthcare services in much greater proportions, spent much more time in cooking, spent much more time in cleaning, as well as childcare. Uh, there was a lot of incident of increased household tensions reported by women as compared to men, and there were also incidents of increased violence at home reported in greater proportions by women. So all of these reasons combined together call for a greater need for measurement around topics of gender equality and empowerment during this COVID-19 pandemic, and to respond to those growing calls, we at Emerge started to develop modules that can be adopted by researchers and practitioners. So far, we have developed 13 modules on several topics, including women and girls agency, domestic work distribution, education, uh, family planning and reproductive coercion. And all of these modules are available on the COVID-19 page on Emerge. Uh, uh, when you click on any of these 13 modules, you would be taken to uh, uh, a really adaptable version of the module, which not only houses the questions that we have curated from multiple sources, but also provides details of the sources that they were adapted from. Uh, this kind of going back to our survey right here helps researchers and practitioners to really pick and choose the measures that they want to survey and adapt it in their current settings. A couple of pointers before researchers and practitioners can start using these modules. First of all of these modules are completely open source. Uh, Anyone can pick and choose questions as needed. There's no need to adhere to the exact format that's mentioned in the modules. Uh, One important thing for us to note is that these questions were picked from multiple sources. So psychometric properties of these modules have not been tested yet. While we have tried to ensure that we are picking up questions from really reliable and valid sources, the mere fact that we are combining questions from multiple sources, we do not know the psychometric properties of the module that we ended up creating. Uh, so we would really appreciate if the community really feels free to adapt questions to the specific geopolitical and socioeconomic context as needed. Researchers might need to restructure certain questions based on survey methodology, and we'll talk about that in a couple of minutes. But we would really look forward to hear on how it goes, and if any group or any researcher is able to test psychometric properties on these modules, that would be really welcome, and that would be a really great contribution at this point in time. Uh, I'll take a pause here to welcome Dr. Mohan Ghule. Dr. Mohan is a senior researcher at GEH and leads work on a very exciting project called Charm from Maharashtra, India. Dr. Mohan is currently joining us from Junar, our research site in rural Maharashtra, and will be sharing very fresh insights emerging from the field at this time. We may have some connectivity issues, so please bear with us. Dr. Mohan, over to you.
Yeah, yeah. Thank you, Arnab, for introduction. Okay, for next 1 minute, I am going to tell you about Ram project, which is a very big project, but due to time stress, I am able to more detail. So this is the short how husbands try to productive health actually. So basically, this is gender equity focused family planning program where the interventions are provided for men and women. And we all know that unintended pregnancy, unsafe abortion, miscarriage, maternal infertility, and mortality are some of the problems that we try to address through the. And if you think of rural India, uh, poor people, those who are
Okay, I think that we may have lost Dr. Mohan. Um, I'm going to have Nicole John step in, who also works on charm with Dr. Mohan, so that she can finish the thought that he was starting. So Dr. Mohan was telling us about the charm intervention. So Nicole, could you recap that and then maybe go into the issues?
Absolutely. Hi, everybody. My name is Nicole Johns. I'm a data analyst, and I work with Mohan Gulli and others on the Charm 2 project. The project, apologies if this is repetitive, but a few of you might not have heard what he just said. The Charm 2 project stands for Counseling Husbands and Wives to Achieve Reproductive Health and Marital Equity. It's both an intervention and a randomized control study of that intervention. It's a 5-session counseling intervention focused on family planning, marital communication, and reduction of marital violence. Now, by pure happenstance, we happen to have our first follow-up survey conclude exactly 1 week before the countrywide lockdown began in India. And we just began our second follow-up about 2 weeks ago. So while we don't have data collected during the lockdown, we have this very much a pre-post set of survey information to look at. For just a little bit of context about what that lockdown looked like, this was a total lockdown, meaning that within villages there was no leaving or entering, with the exception of essential services. And while hospitals remained open, they were just for COVID and emergency care patients, not for family planning. And many of the providers in this area are smaller private providers, and family planning in this area is also commonly accessed via chemist shops or pharmacies, all of which were closed during this time. And in particular, this is a married and relatively young population. Our inclusion criteria stipulated that women had to be between 18 and 30 years old at baseline. They also had to be unsterilized at the time of recruitment, which will be important when we think about continued access to sexual and reproductive health care services. And this was a largely sexually active population who were interested in either having a first child or more children for the most part. So given all that, the most wide-reaching COVID-related gender equity issue we anticipate seeing in our study population will be access to sexual and reproductive health care. And secondarily, we will be paying careful attention to increases in marital violence. Like I said, we just began our second wave of follow-up data collection 2 weeks ago, so we cannot say yet if we've seen those effects, but we anticipate that COVID will have the largest effect on those domains.
Great, Nicole, I'm gonna pause. Mohan said he's back, so let's see if we're able to hear him this time. Go ahead, Dr. Mohan.
Yes. So, well, for introduction to the CHARM project, actually my connection is unstable, and that is the problem I faced. I continue G, E, and these are our observation, my observation in the field. And not anything, these are just in age. This any problem is most in this pandemic. So first is family. When we talk about the family planning, there are major issues. During the law.
Okay, we may have just lost him again. Nicole, let's just have you finish up and we will try to troubleshoot on the side.
Okay, sure thing. I can give you, since I'm the data analyst, I like to pull a few stats up. So when we're looking at our population, part of the reason that we're so concerned about the closure of chemist shops and other private family planning providers are that most of the women in our population who were not pregnant were using methods that they would likely need to get refills on in the time period that the shutdown occurred. So most of the women were either using condoms or pills. We also, at the time of follow-up survey immediately prior to the lockdown, about 12% of women were pregnant and were interested to examine any impact on prenatal, delivery, and postnatal care. And one other sort of interesting nuance of our population is that about 70% of the women are living in the same household as their mother-in-law. So we often talk about sort of challenges to women's agency within households, being within your husband's family's household adds an additional layer of complexity to that agency. So I think that's something else that we're going to be paying careful attention to at our second follow-up. Yes, I believe that's about it.
Great, thank you.
Awesome. Those were like really great insights. It's unfortunate we could not hear Dr. Mohan speak more, but Nicole did provide a great set of statistics as well as insights onto the issues that are emerging from the field right now. With that, we move on to the next section of the presentation, where we talk about how to conduct surveys on GE ethically and safely at this time. And we'll be mostly focusing on some of the practical considerations and logistics of data collection at this time. First of all, before even we begin with data collection, it's really important for us to be purposeful more than ever. We really need to be cognizant of the risks that both interviewers and respondents will be taking if there's a face-to-face interview that's being planned. And we also need to recognize that a lot of respondents might not be as open to sharing their time during this pandemic. So it's really important for us to be clear on research questions and limit our survey measures to those that are absolutely needed to answer the questions and describe our sample. It's really important for us to ensure brevity in the measures that we use now more than ever. Apart from being really purposeful on our research, there's a couple of other practical and logistical considerations. If a research group is planning to do in-person interviews, then it does pose a viral exposure risk to both interviewers and respondents, but there can be ways to move around that. There are innovations coming up, such as handing over the tablets to the respondents from a distance, and the respondents then filling it on themselves. Some of these innovations might affect confidentiality. Apart from in-person interviews, there's a lot of focus on telephonic interviews and online interviews that is currently going on that addresses the challenges that we face during this pandemic. A couple of pointers there. That a major consideration for conducting telephonic interviews is that it might lead to sampling bias. And one really smart way to address that bias that we discussed in the webinar this morning was to go back to previous cohorts that you might have collected before the pandemic. So any kind of house listing exercises, any kind of screening exercises that might have happened where we collected telephone numbers of respondents would be really useful at this time to ensure that we mitigate sampling biases and draw a representative sample. As I mentioned, at this time, people may be less available or less open to participate in surveys, and we need to be sensitive about that. Another major challenge that comes up at the time of, in data collection at this time, is to conduct trainings of data collectors. Most of the time that we think about conducting surveys, we are thinking about how to, conduct in-person surveys versus telephonic surveys. However, we probably lay less stress on the fact that At this time, it's really difficult to conduct in-person trainings as well, and a lack of such opportunities might lead to data collection issues or insufficient trainings being provided to data collectors. However, with the advent of technology and things like Zoom, I think we can really take or make things to our advantage. For example, Dr. Karen Austrian earlier this morning was sharing how in Kenya, Population Council was leading online trainings of data collectors where they recorded training sessions and PowerPoints on Zoom, and later had like multiple sessions that were conducted for multiple teams of data collectors. So innovations such as these that deal with technology can really help us address some of these logistical challenges that we currently face. Uh, Apart from that, we also need to address a couple of things. I talked about how we uh, uh, really need to ensure that the survey length is really short. We need to ensure that reading of questions feels like a conversation when we are conducting telephonic interviews. We cannot have a lot of matrices, and structures within the questionnaire that's not conversation friendly, so to say. Uh, Apart from that, we also need to be sensitive while designing questions. Some of these sensitive questions that we ask require respondents to say the responses out loud, which might not be very ideal. One way to work around that is to read out the responses to the respondents ourselves and tell that okay, if you want to select option A, then just say one. If you want to select option B, then just say two, and things like that. That ways, even if she has people around her, uh, she does not need to call out the responses so that everyone knows what she's talking about on phone. Uh, this brings us to a module that we created last month, where we developed protocol recommendations for conducting telephone based surveys, and it's available our on the COVID page in our website. This is a really comprehensive guideline that talks about 5 different sections of how to ethically conduct telephonic surveys, including creating a rigorous, valid, and practical survey that ensures clarity on key gender constructs, that allows us to adapt items and responses to our specific context and populations. It talks about sampling and respondent characteristics. It talks about how to minimize risk regarding participant safety when assessing gender-based violence. And it also talks about ways to improve phone-based survey implementation, primarily by selecting and training the right kind of interviewers, and also provides guidance on how to conduct effective telephonic interviews. A couple of things that we need to keep in mind when we are ensuring or when we are trying to assess gender-based violence through telephones. First and foremost, selecting only one respondent per household. Secondly, training interviews to detect and respond to indicators of distress from participants. Uh, our investigators or interviewers need to be sensitive enough to pick up signals of distress coming up from respondents. Other things, such as ensuring that the research team or interviewers have information about gender-based violence support services, and providing clear instructions to the respondent after completion of the survey in case they are taking the survey on their phones and there's a chance that there would be a digital record of the survey that she took. Providing clear instructions on how to delete that so that no one else can see the history of the survey that she just took. Uh, Clearly reading out responses and asking a respondent to select a number rather than read out rather than speak out a response option out loud would be a really practical way to minimize risk to respondents. Uh, we have come to the end of my session here, and again, I would hand it over to Dr. Mohan and Nicole to talk about some of the practical challenges that were faced when doing the surveys in Maharashtra, and some of the ways that they would suggest and recommend to addressing these challenges. Nicole and Dr. Mohan.
Thank you, Arnav. Sorry for interruption, earlier interruption. Uh, we started, as Nicole has already introduced, we started our headline survey, that is 18-month survey in last month, and it is almost 3 weeks. And this was still, it is unlock period 2 in India. And we started during this unlock period 1. So we were waiting for almost last 3 months to start the survey activity, but it was not possible. And with this not very conducive environment, we are still working, and we face day-to-day challenges to continue this activity. So first is permission. When we started the activity at baseline, we informed all village aides as well as primary health centers and sub-center people that this is the activity which will be continued for a period of 2 to 3 years, next 2 to 3 years. And after that, we had 9-month survey, and we never informed it. But now the situation is very different. Villagers are scared. Whoever enters, a new person enters in the village, is really scary for them, and they go on asking a lot of questions. So we started with the permission letter. We provided a letter to the village head, as well as primary health center doctor and nurses of all these sub-centers, that we are going to start our survey. And probably the survey activity will continue for a period of another 2 weeks in this particular village. So if anything happens, or if any of the respondents complains that these news people are coming and collecting information from us, so in that case, at least what is happening in the village, village head should know what is happening in their village. So that is the purpose of providing this permission letter. And this permission letter is from ICMR Institute, one of the collaborating centers for this project. And so it shows that it is from the government of India. We are working in the health aspect, and so there was no hesitation in giving the permission. So with this permission, we are quite comfortable and continue our activity. Second is privacy. During this COVID period, a lot of people have migrated. Our respondents have migrated to some other place, whereas family members who are working in nearby major cities have come back to their native place. So there are many more members are present in the family. Mobility is restricted, and that is why when our investigators go for interview, then they have to entertain each and everybody. So the interview time is 45 minutes, but another 45 minutes are spent for introducing the program again and again, telling them the importance of the study. And so that is really interruption because of the presence of other family members. So many times you have to pause the interview and then again restart the interview. Also, interview time is a constraint, so we spend more time on interviews. Sitting arrangement due to social distancing is a major problem. These houses are very small, and at the same time, we are conducting male and female interviews in the same household. It's a couple interview. So again, maintaining privacy, because we do talk about family planning, sexual violence, gender equity issues. So these are all sensitive issues, and we try to maintain the privacy. But getting privacy is a problem in that particular situation. So many times we have to take that respondent under the tree, or sometimes in the farm, and maintain that privacy section. So social distancing and also taking care of other, like wearing masks and precautions. So these are some of the issues with this. Earlier survey, respondent provided enough time, but now they are a bit scared, and they are hesitant to provide the information. So that is another obstacle in this program. Refusal due to more number of visits because we had number of visits to a particular respondent. These are selective couples, and this is the third survey going on with these couples. And couples who are in the intervention area, they already visited provider 5 times, or provider visited their household 5 times. So almost in the last 18 months, the same respondent visited almost 8 to 9 times, at least in intervention area, and 3 times in control area. So that becomes one of the reasons why some of these respondents are refusing. Then they are reluctant to talk due to fear. Then they are shy to discuss these issues in front of other family members. Uh, Migration in and out of migration is one of the issues. Our respondents have gone back to other places, and they are not able to come back because of lockdown situation. Whereas the many of these migrated people from major cities are in the family, and they really disturb whole survey activity. Uh, Disclosure of respondents' exposure during lockdown period is another issue. Many of these respondents during night time, they work as drivers, or so they do some kind of other jobs, and they go to nearby cities. Whereas when we go for the interview, they do not reveal all the status. Few of these respondents, they suffer from minor cough, cold, sign symptoms, but they do not reveal when we start the interview, and probably when they are comfortable, then they go on telling that okay, we face this kind of problem. So that really creates a risk for the investigator as well as investigator, but because when we interview them, we do not know the exposure, their exposure status at that time. But still we follow all these safety measures and continue the activity. Uh, Few of these respondents, though there is a lot of social media awareness, I will not go into the details.
Okay, I think that we may have just lost Dr. Mohan, but it actually sounded very good and came through clearly up until now. Um, Thank you so much, Dr. Mohan. I think we'll take a few questions with our remaining time. I'm so sorry to lose the last couple points there, but really glad that the connection worked out much better for that. So next slide. Great. So I think that we had a couple questions in the chat box, and I would ask Arnav, Nicole, or Dr. Mohan if he gets back on to just volunteer yourself to answer the questions. So the most recent one is interested to know how to accommodate side questions during interviews and fit them into the survey. Interviewees may expect information related to COVID-19 that's not part or necessary in a GEE survey. If you don't have the answer, Nicole or Arnav, that's okay. There may be somebody else on the call who might have an idea from their experience we could also hear from, so let me know.
Yeah, I think it's a great question, and we can certainly hear from anyone else who has thoughts on this. My quick take would be that as we are developing modules and sets of questions for COVID, none of the modules are really tested in the field. So if this question was asked to me about already established or already valid set of questions, I would say that okay, don't touch the flow of the questions, or don't change the way the items are structured right now. But then, since all of these modules have just been built and still need to be tested in the field, I think we have a lot of flexibility in adding additional questions as researchers see fit to be included. If you think that the questions that we want to add are completely off topic from a given module, what we can do is just add a separate small module with related questions that hang together well. Always think back about the concepts of reliability, where we try to say that the items that we are including for a particular measure should hang together well. So if that principle is adhered while developing new measures, I think that would lead to really good quality survey instruments. Uh, but yeah, as you said, Meredith, we would really love to hear from all participants on their experiences with COVID-19 research, especially related to GEE. Any kind of experiences emerging from recent surveys would be really awesome to hear.
So if you would like us to help you unmute yourself if you had any additional thoughts to this, feel free to type into the chat box. In the meantime, we did get one other question that I think our colleague Namrata has already helped to answer. Have there been any syntheses done on gender issues during COVID? Because there's several studies out there, it would be helpful to have a synthesis. I think that Namrata shared a synthesis or a policy brief from the UN, but it did remind me, Arnab, that at the bottom of our COVID page, we have started collecting external resources. So in addition to our modules that we have in the middle of the page, we've been putting together resources related to COVID and women and girls empowerment and gender there. And some of the resources that we have listed are actually collections of other resources. So in addition to the one Namrata shared, do you know of any other good syntheses that you would recommend?
Yeah, I would point to this top resource right here, the IPA Recover survey. We were using it of late, and it's a really good set of questions. In addition, if we are also interested in data on COVID, especially sex disaggregated data, the Global Health 50/50 sex disaggregated data tracker is really useful. They were one of the first teams to come up with sex disaggregated data globally. They launched this early in, I think, May, and they have been adding more countries and more populations to go on. One of the very interesting data points that Global Health 50/50 has is on healthcare providers. So number of cases and deaths amongst healthcare providers. They had it for 4 countries to begin with, but I'm sure they are going to add more to that list. So yeah, I mean this resource is like a really good set of resources, which a lot of which are a collection of multiple resources that we can go to and refer while developing our own survey modules.
Great, thank you. I think we have time for another question if anyone has one last question. And Nicole, in the meantime, Nicole also shared another great resource in the chat box. All right, everyone, I'm not seeing any other questions come in. So we just wanted to thank you from the Emerge team, which we have listed here on our last slide, as well as our guest speaker, Dr. Mohan and Nicole, for sharing the CHARM study insights from the field during COVID, and to our funders, of course, who we've acknowledged here, and to Karen Austrian at the Pop Council for also letting us share some of her experiences. So thank you, everyone. We will share the slides and a recording of the webinar with you through the registration site. And if you like, please check out the website that we've shared, emerge.ucsd.edu. You can register there for updates, follow us on social media, or contact us at this email. Thank you so much. We really appreciate it, and we hope that you have a great rest of your day wherever you're calling in from, and that you stay safe during this time.